You're listening to Advice from Your Advocates, a show where we provide elder law advice to professionals who work with the elderly and their families.
I'm really excited about our guest today. We've got Michael Hession, a cardiologist. And Michael, welcome and thanks for joining us. Can you tell us a little about yourself?
Sure. Thank you for having me today, Attorney Mannor. So my name is Michael Hession. I'm a practicing cardiologist. I'm the medical director of Mass General Brigham Harbor in the South Shore of Boston. I went to Boston College and then to Dartmouth Medical School. I've been in practice since 1985. Life for me went quite well until the week of Christmas in 2013 when I developed a cough, and then it relentlessly went downhill and resulted in a near-death experience and a prolonged hospitalization and even longer recovery. Led to a book that I wrote, Physician Heal Thyself, Nearly Dead in the Journey Back to Health, and it got me back to work and doing what I love best.
I want to repeat the name of that book because it's a really interesting name, Physician Heal Thyself, Nearly Dead in the Journey Back to Health. So tell us about that experience that inspired the book.
I was working, as I normally do, about 60 hours a week and getting ready for the holidays, and I developed a cough the week before Christmas. Got worse. I was seeing my primary care doctor, started on some antibiotics. Got worse. X-ray showed a pneumonia, but my vital signs were fine. Had to change up my medications, but things continued to relentlessly go downhill. And on New Year's Eve, 2013, I woke unable to breathe, and my wife had already been awoken by my labored breathing. Called 911. I was brought to the hospital, and in the emergency room, where it was pretty obvious to everybody there that I was in deep trouble. The pneumonia had spread to both lungs. I had what's called a acute respiratory distress syndrome. I think recently it's been referred to as cytokine storm. I was hypotensive and shock. I was intubated, started on life support, and things didn't get better. And it was recommended I be transferred into a Boston teaching hospital to be started on ECMO, which is extracorporeal oxygenation, which is essentially they take your blood and pump it through an artificial lung and put it back into your body because your own lungs aren't working. So I was sent to the Brigham, and I was intubated on life support for about 11 days. It was really touch and go for a while there. So when you're intubated, it's a very uncomfortable procedure. So you're given heavy sedatives, muscle relaxers, and painkillers to allow you to tolerate what would be otherwise intolerable. I was aware. I mean, I could hear people talking around me. And being a physician, I knew what the implications of what the discussion was about my health, that it was not likely that I was going to survive. It was terrible. And being intubated was probably the worst experience I went through. One of those experiences, I didn't come back the way I did with the previous experiences, and I felt myself drifting off and my body becoming cold, and I could hear crying, mournful crying, and I couldn't really tell where it was coming from. And at some point I was able to see it was my family crying, and I didn't understand what that meant. And then the crying disappeared, and it was that point that I realized the crying was from me, that I must be dead. And I don't know how long I drifted. There was really no sound. It was just cold black. Then I became aware of a white light that I was being drawn towards. I got closer. It had the appearance of a woman in white shimmering robes, and she said, "Michael, it is not your time. You must go back." I didn't really know what that meant. The next thing I knew, I heard my wife speaking into my ear, telling me it was good news that the doctor said I was beginning to respond to treatment. That image has never really left me. I think that was something that I couldn't explain, but it was real.
I've got a lot of questions about what you were just going through, but the most important question is, how has that affected you moving on? So, you described a life that many of us follow where we work very hard, that we're working perhaps too many hours, that we have that drive and ambition. And how has this affected your life since that experience?
Excellent question. Well, it changed me profoundly. I became much more aware of how precious and how fleeting that life is. And that, I probably was spending more time working than spending with my family and doing things for my own self-improvement. So it led to, over time, rebalancing the work life. And it also, surprisingly, and this is really hard to explain, but I didn't fear death. I think death was kind of a scary thing for everybody. For me, it was. But after this, I didn't fear death. I also became more empathetic in how I listen to my patients. The difference between empathy and sympathy is really quite a lot. And I was able to find that I was listening to my patients more empathetically than sympathetically. And as part of my rehabilitation, I had learned meditation, specifically mindfulness meditation. That really allowed me to be totally focused on my patient at that time, not to be distracted by other phone calls or beeps or other things. And if other things came up, I just noted them and they went off to the side, but I was able to 100% focus on what the issues were that my patient was concerned about. So I think, surprisingly, the whole experience made me a better person, a better physician, a better husband, a better parent, and a better person.
I'm curious about first of all, I'm curious about your experience as a patient, being on the other side of it, and your experience and how that might have affected you. But really, I'd like to learn more about how you felt going through that healthcare system, how you felt as a patient, and if that, what was there anything that was sort of eye-opening, or that you experienced it in a different way because you're now a patient instead of the doctor?
Absolutely. Another great question. As I said, I was aware, even though I was intubated, unresponsive, unable to communicate. I could hear other people talking. Two things that were really important. One was my family was with me every day. They were allowed to stay with me 24 hours a day. Their presence was sanity saving. They spoke to me every day, held my hand, and comforted me. When I first was in training in medical school and in residency and first as a physician, families weren't really encouraged to be in the ICUs with their loved ones. Time was limited to 15 minutes and only certain hours of the day. Over time, patient-centered medical care became more of a concept, and the realization that having family members present was important. But I have to say, I never realized how important it was until I was on the other side of the bed. The other thing that was eye-opening is how few of the healthcare providers took time to talk to me. I think when you're intubated, unresponsive, unable to communicate, it's very easy to think that they can't hear or they're, unaware of what's going on. But I have to say, I was quite amazed at how aware I was and how grateful I was when anybody took the time to speak to me. I had one nurse, every time she came on, she would introduce herself, tell me what day it was, the time it was, what was going to be happening to me. And it was just so reassuring. I can't emphasize how much that meant to me. In the morning, the phlebotomists come by early, like 5 a.m. to draw your blood, so it's ready for when our staff round on you. And they would always talk to me and say, I'm here to draw your blood. You're going to feel a little pinch. And then they would say, I'm done. And then they would leave. They're like ninjas coming in the night and were there for only a few minutes and they left. Those interactions, really treating me as a sentient human being, were profound. And I think some of the feedback that I've gotten on people who've read the book, particularly healthcare providers, they were actually amazed and shocked and chagrined at how much people could hear and understand, how much awareness there was. And I think it's led to many of them changing how they care for patients.
Very interesting. So many years ago, when I was about 40, I had a cardiac event and I was in the ER. And my experience was very interesting as, you as a doctor probably had a better understanding and kind of understood what was going on around you a little bit better. For me, even though I interact with the medical field quite a bit, I'm not a doctor. And if you ever want to see an ER staff move fast, go in as a 40-year-old with a cardiac event, because everybody was running around and just circling and everybody was talking and just it just was so much activity. It was very overwhelming. And I feel like that, well, that was, my particular experience. I eventually got an ablation and everything's fine. But the issue was that it was just so overwhelming as a patient. And I'm interacting and I'm advocating for my clients and advocating for their healthcare. And it was just so much of a unique experience being the patient, and how much the activity that was going around, how when I moved from the ER to a hospital room, everybody coming in, everybody kind of telling me what was going on. And on one hand, I can understand what you're saying is that interaction was positive. For me, it was overwhelming because I had probably 30 different people describe my symptoms to me over a span of about 2 hours. And that was a lot to take in from that kind of experience. Having been, as a cardiologist, I'm sure that you're kind of used to the flow of the hospital and the energy of the hospital. But for someone that's not experiencing that, that can be overwhelming too, I think.
Oh, absolutely. It was overwhelming for me. And I realized in retrospect how overwhelming it must have been for many of my patients.
Mm-hmm.
And it gave me a deeper understanding of what they went through. And I think, as I said before, it made me much more empathetic in understanding what they've been through and helping them discuss, the whole experience. I talk in the book about critical medical illness and PTSD. I think, post-traumatic stress disorder is something that wasn't even a concept when I was in medical school.
Interesting.
It really wasn't until well after the Vietnam War that, the whole concept of PTSD became a topic that people really believed was a true phenomenon. I think,
Wow.
in World War II and World War I, it was called battle fatigue, shell shock.
Yeah.
And they didn't know how to treat it. It was only after Vietnam that they began to develop some insights into PTSD. And I think it's still ongoing. I think still people are trying to understand PTSD and how to treat it. It's less understood that PTSD is something that can happen to people who've gone through a critical medical illness. They can. And it's important to let people know, as well as their family members who can also suffer PTSD, that if you start to feel symptoms of trouble sleeping, anger, nightmares, that they're probably part of PTSD. And I think when people can name something that they're feeling, it goes a long way to helping to solve the problem. But I think there are ways now that are recognized that help people deal with PTSD. But as a patient, if you don't know what you're feeling, you really don't know what to do. And it can lead to what's happened over the years with people who come back from wars or people who suffered violence, these symptoms, and they self-medicate with alcohol or opioids, and it leads to a lot of bad behavior. And then it becomes a whole different issue, much more difficult to treat, because now you're dealing with the downstream consequences of unrecognized PTSD. But I think anybody who suffered critical medical illness or even any severe medical illness, they need to be counseled that they begin to have these feelings of, experience trouble sleeping, nightmares, or other signs and symptoms of PTSD. They need to speak to their, physicians about it and get help to deal with it. I think when it's caught early, like anything, it's a lot more treatable than if it's caught late and some of the red flag behaviors of self-medication become a bigger issue.
That's very interesting. And you brought up the World War II, and where, we have fewer and fewer of our World War II veterans with us anymore. But over the years, that is something that we've experienced, where World War II veterans in particular, and of course, this is true for any veteran, but World War II veterans in particular were often didn't seek out the help and especially when there's benefits and things like that to the Veterans Administration, they didn't seek those out, so that sometimes it's 50, 60 years later when they're finally starting to realize that there are some benefits available to them. But I'm particularly interested in the PTSD from a medical event, and that is something that I think probably a lot of people overlook. And so you had mentioned the first step is to discuss it with your doctor, perhaps get some counseling. What are some of the triggers that might trigger PTSD for somebody that experienced PTSD from a medical event? And then what are the other things that they should be doing to address that?
Well, I think, again, it's important to instruct patients and their families that if the symptoms of PTSD, and there's a long list of them, start to become an issue, trouble sleeping, anxiety, anger, nightmares, that it's not in their mind, it's not them, it's really a consequence of what they went through. It's not unexpected to name it, to normalize it, and then to get help. I think, from many years, I had seen patients who had survived cardiac arrest, heart attacks, have emergency bypass surgery, and come back and they're healing, and they're having a lot of trouble with nightmares and trouble sleeping, and their primary care doctors would just give them benzodiazepine or something to help them to sleep, and it really wasn't dealing with the root cause, because really there wasn't an awareness of this. There still isn't, and that was one of the big goals that I was hoping to make, is to really increase the awareness that this can happen to not only the patients, but the family members of patients who've gone through critical medical illness, as well as the caregivers. I mean, it's been estimated that close to 20% of the healthcare providers during the pandemic have dropped out of their fields because of the trauma that they experienced. It's very real, but I think, there isn't as global an awareness of PTSD from something like illness out there as there is, say, with school shootings or violence or war. But it's very real. And I think that it's very important for people to realize that these symptoms begin to show up, that it's not in their head, it's not a weakness, it's something that's very real, it's something that's very treatable. And I think, my goal really in during these podcasts and in my public speaking in writing the book is to just really to normalize this whole concept and to get people comfortable with talking about it and getting the treatment. It's, I think, being a tough guy, being macho, or, this is all in your head, you can get over it, snap out of it. That's not the way to deal with it. I think it really needs to be normalized and to be acknowledged and to be treated. And I think the American College of Family Medicine just adopted a policy advising all their physicians that anybody who's come in to see them following a hospitalization for a critical medical illness should be screened for signs and symptoms of PTSD. So I think incrementally there's increasing awareness of this, but it's not top of mind the way it is with the school shooting from combat veterans, but it's very, very real.
I'm curious about, with your experience, it sounds like there was a lot of recovery that was necessary. How long did it take you to go back to work? And did you actually think about not going back to work after that?
Yes, excellent question. Things were not a straight line.
Right.
As I said, when I, after 11 plus days of being on life support, I was taken off, and they put on a mask called a BiPAP mask, which is hair down to my chin, and then very sturdy straps held it in place. And just to force oxygen into my lungs, which were severely damaged. And, one night I was having trouble breathing, and my son was there, and they'd given me a nurse call button to push if I needed help, but I couldn't move. I couldn't use the button. My hands were useless. I couldn't activate the call button, but my son was there. He saw that I was in distress, and he called the nurse, and physicians came, and they treated me and got me through it. And after a few more days, they were able to switch me to just oxygen from the nose, and I was sent to rehabilitation with oxygen. And at nighttime, what would happen is I couldn't move, so I was placed on my back. And at nighttime, my oxygen level was a drop, and the team would rush in, turn on the lights to be certain I was breathing. This would happen every night.
Wow.
To the point that I was afraid to sleep. I was afraid I was going to stop breathing. And it took a long time to really, get to the point where I could not be afraid to sleep. I was in inpatient rehabilitation for 6 weeks, and I was about 15 months or longer before I was able to go back to seeing patients. I started slowly. I wasn't really physically strong enough to see patients in the hospital, so I had to give up going to the hospital, and my practice is confined to seeing patients in the office. But little by little, I gained strength and built myself up to, working 5 days a week. Things were going well until I had my second near-death experience.
Oh, boy.
I had developed over the years diverticulosis, which I didn't even know I had. I had one episode of diverticulitis in the hospital and a second episode of diverticulitis, and that resulted in an abscess. And I had to have IV antibiotics for 6 weeks and then elective surgery or urgent surgery to remove the abscess. Everything seemed to go well until the anastomosis broke down. Part of the treatment for the ARDS and the cytokine storm, I was on high-dose steroids, which are the only medicine that is shown to help. And there's no real treatment for it except supportive. But steroids impair healing and predispose you to infection. I woke up in pain, and I said to my wife, "You need to take me to the hospital." And on the way there, I began to lose consciousness. And by the time I got to the hospital, I was in shock. And I remember the intern or resident who was looking at me, he said, "Is your blood pressure always this low?" I said, "No." And that was the last thing I remember.
Oh, wow.
I woke up, I think it was the next day, and I had to have, I had an abdominal catastrophe. My anastomosis had broken down. My belly was filled with pus and everything else. And I had to wash it out and had to have an ileostomy. And that was a low point for me. Everything that I've been doing, getting stronger, doing physical therapy, went from inpatient to outpatient physical therapy, getting back to work, everything went back to square one. And not as long a recovery from this, but I did manage to build myself back up and was able to have ileostomy reversed and had to rebuild myself with physical therapy and start back again slowly to work. But I managed to do it, and I was very focused. Being a physician gave me meaning and purpose in life, and I really took strength in that. Getting back to see my wife and my family was important. Getting back to seeing patients gave me meaning and purpose, and I used those to motivate me to get through the physical therapy and to do what I had to do to get stronger.
I can imagine that is very important, to have a purpose, to have that passion, and because it must be very difficult to go and have to rebuild your strength twice like that. How long was it between those two events?
A little over a year.
Oh, wow. So pretty close together, too.
Yes.
Now, you wrote the book after the second, the diverticulitis, then you wrote the book after that, or was it between the two?
No, I actually didn't write the book until I didn't start writing until January of the pandemic.
Oh, well, okay. That makes sense.
They had, when I was at the rehab, they had recommended I keep a journal. It was a practice I had started when I was in high school. It was not a diary, really, just as I had thoughts or impressions, I'd write them down. Sometimes there'd be a sentence, sometimes there'd be a paragraph. I found those journals, and I wasn't quite sure what I was going to do with them. I was at home with nothing to do, and I was watching the television nonstop coverage of the pandemic and the horrors of that. And there was one, it was a 60 Minutes, had a story of a fellow who was intubated, had a long intubation for ARDS and cytokine storm, and made it home, was trying to rebuild his life. My son was a resident in New York at that time. With this talk of the horror, there was, at that time, New York City was the epicenter of the pandemic.
Right.
And I felt like I should be able to do something. And I realized physically I couldn't do anything, but I could tell my story of what it's like to have ARDS, cytokine storm, and to survive and to rebuild your life. So I started to write the book in January. By that summer, I had pretty much written most of it. I began working with an editor to make it into a narrative that really people could relate to. I purposely didn't want to make it a very long book. I wanted it to be readable, not a 300 or 400 page,
right,
thing that no one would be able to get through. So it's a short book, but it's concise. I think the feedback has been quite extraordinary. I mean, I've had people reach out to me. It's been very overwhelming, the response. The reviews on Amazon and Goodreads have been pretty extraordinary, and people have been just coming up to me and just saying, I really enjoyed your book. I can't tell you how much it meant to me. And they would talk about their experiences with their own personal illnesses or loved ones. And how it made sense. I think it's having the desired effect. I was recently asked to give a Schwartz rounds at a social hospital in Weymouth, Massachusetts. Ken Schwartz was a lawyer in Boston in 1994. He got diagnosed with lung cancer. Never was a smoker, but he ended up dying in 1995. But he set up this foundation to encourage people to find ways to work with patients and their families compassionately and to improve care, particularly care at the end of life. And they picked my book to highlight this meeting. It was quite well attended, and I think I was surprised by how many people who really came up to me afterwards and sent me notes as to just how powerful they found the book to be, and also my recounting of the experience.
And Dr. Hession, you, in addition to the book, you also have a website. I'm very interested in that. Acknowledge, accept, adapt.com. Tell us about the website.
Well, the acknowledge, accept, and adapt were over the years of practicing, I realized that I had to have a message to my patients to help them to understand what was going on. Because, as you said in your experience, it can be pretty overwhelming, and the medical terminology is like very arcane. People don't understand it. So I had to find my own way of being able to relate to my patients and discuss what they had, whether it was high blood pressure, diabetes, heart disease, arrhythmia. So the first step, you had to acknowledge what you had. It's not easy to do. People are overwhelmed. And so we would talk about what the condition was and help them acknowledge it and to be able to name it. The second word, accept. People would get angry, deny that they had the problem, and I would help them work through the importance of acceptance is in recovering from any illness or living with any illness. And the final one was adapt. You had to really figure out a way to move on. Accept that you had the illness. Don't get angry about it. Waste energy in fighting something that you can't win. But to adapt. As my father said to me many times growing up, son, you have to play the cards you dealt with in life to the best of your ability. Never quite really fully understood those words until I got older. But, it's really the people who can acknowledge, accept, and adapt are the ones that do well. And I saw that, when I was in Spalding Hospital. Because I couldn't move, I had Guillain-Barré as a complication of the viral pneumonia. They put me on the spinal cord floor. And there was one other patient with Guillain-Barré recovering from a pneumonia. And the rest of the people were paraplegic or quadriplegics. And it was easy to see the patients that were making progress. They were able to acknowledge what they had, accept it, not get angry about it, and find a way to move forward. And those are the patients that did well. The patients that floundered couldn't do it. They couldn't put the acknowledge, accept, adapt together. And it's, when I was thinking about how I could have a website and help people to really deal with whatever they're experiencing is important. It's important to acknowledge, accept, and adapt. And so I use that as the website because it's crucial. Everybody gets something. I mean, no one gets through life without getting something. And you never see it coming for the most part. It never comes at the right time. And one of the books that I read did a lot of reading when I was recovering, was a book called The Ice Bucket Challenge. It was about a young man who went to Boston College, I did a few years later. He was a baseball player and an excellent baseball player. Not good enough to make the pros, but he was a good baseball player. And he played semi-pro after he graduated and played in a league for people who love baseball. At some point in his late 20s, he began to have trouble fielding grounders and throwing the ball accurately to get somebody out at base. And he went to seen a number of different specialists, and he was finally diagnosed with Babe Ruth disease, amyotrophic lateral sclerosis. It is pretty much a death sentence. There's no treatment for it. There's very little research being done. It is considered an orphan disease because it affects so few people. But he was surprisingly, energized. He saw that this really gave his life meaning and purpose, that he was going to spend the time he had remaining, raising awareness of ALS and fundraising for research. And by the time he died, he had raised over $200 million and made ALS a much more of a household name, and jump-started the research into this disease. And progress is being made. So, here was a guy in his 20s, the prime of his life. Diagnosis was 3, 4, maybe 5 years before you die. You're going to progressively lose all your coordination, use of your arms, your legs. Eventually, you can't even speak. You're confined to a wheelchair. Yet, he was able to take that diagnosis and find meaning and purpose in his life, acknowledge, accept, and adapt, and to really use his life to do something good. And so I think, it's possible, very possible for anybody, no matter what their situation is in life, if they're willing to acknowledge, accept, and adapt, to find a way forward, even when a way forward isn't clear. His name was Pete Frates.
That I really like that phrase, to acknowledge, accept, and adapt. We have a lot of my clients, one of the things that we focus on is helping families that are someone in their family that have some form of dementia. And that is very much, those 3 words are so important when it comes to dementia, because people tend to not want to acknowledge it, refuse to accept it. They tend to be in denial about it. And instead of trying to adapt, they just kind of cocoon and don't interact with others or seek out resources. So I think that's a great slogan, a great advice, particularly for those families that are experiencing a loved one with some form of dementia. Acknowledge, accept, and adapt. And there is still a potential quality of life to be had, both for the caregivers and the one experiencing the dementia, whatever form of dementia they have. So I just really like that. I think that's a very not only positive acknowledgement, but also important that families really try to do those 3 things to advance really quality of life.
Absolutely. I think, I found that over the years in caring for patients, pretty much everybody that I saw had significant heart disease, had heart attacks, bypasses, serious arrhythmias, heart failure. There was no real cure. There were treatments. But the people who did well were the people that could really acknowledge their illness, accept it, not get lost in denial or anger, and then find a way to adapt, to move forward. I saw many people who would come in, be overweight, smokers, and get religion. They would lose weight, quit smoking, start exercising, and really turn their lives around. And I think it's possible. I think there are very few things we cure. We have treatments, some better than others. Dementia we're seeing more and more of it as people live longer and we're able to control their other medical problems and they're living long enough to get dementia. But I think, you're absolutely right. If they can get to acknowledge their illness and their family members to acknowledge the illness, accept that it's an illness just like any other illness, and adapt. And you can enjoy life, do things while you're able to. But at some point in life, something gets all of us. You can't give up. You can't get angry. Denial doesn't really help at all. And the people that can harness all 3 of those, acknowledge, accept, and adapt, they're the ones that are going to be happy. Their lives will have meaning and purpose, and their families will be at peace with the whole experience.
Dr. Michael Hession, this has been such an important conversation. I very much appreciate, and I know our listeners are going to appreciate this. Any takeaways, any key takeaways that you want to leave our listeners with?
I think that if you're not feeling well and you know something is not right, don't ignore it. Get seen. Don't be afraid to talk about it. I think suffering in silence or trying to tough it out is really not going to help you. And I think that it's the willingness to basically acknowledge that something is not right and to get help is how you will overcome whatever life issue you're going through. It sounds simple. It's not simple and it's not easy.
Yeah, it's not simple. It's great advice though.
But I think if something doesn't feel right, you need to take the time and make the effort to get seen and to be persistent. And, but I think listening to your body and advocating for yourself and having loved ones advocate for you. And also, I think as we age, it's important to have advance directives, have healthcare proxies, because life happens and we all do die, and it's unpredictable as to what event's going to cause it or when it's going to happen. But if you take the time to make your wishes known and to see your attorney and have advance directives and a living will made out, it'll help your loved ones navigate what can be a very difficult time. Being proactive is very important.
Well, thank you for this great advice. Check out Dr. Hession's book, The Physician Heal Thyself, Nearly Dead, and the Journey Back to Health, and also the website acknowledgeacceptandadapt.com. I highly recommend checking out both of those. If you enjoyed this podcast and you'd like to know when there's going to be another Advice from Your Advocates, feel free to subscribe at any of the places that you listen to podcasts, or you can go to YouTube or our website at mannorlawgroup.com, and you can sign up or register for or subscribe to the podcast. But thanks for listening, and we will talk to you next time.
Thanks for listening. To learn more, visit mannorlawgroup.com.